Hey all, Holly Warner here, talking about oxalates. Once again, it seems to be what all of my videos are about lately, but bear with me, it's all very important information that we all need to know. So let's get right down to it. This is video number 2 in a series that I'm doing. I did another one that kind of had a little bit of a breakdown of oxalates and what they are and what they do. And this one I'm going to go a little bit deeper into the information portion. So bear with me. Okay, I want to talk about how we have plant toxins that we're exposed to, but our body creates this hormesis. It creates this response to it. So a little bit of stress is actually not a bad thing. So those of us that are eating certain vegetables and things that have, for example, high polyphenol count to it, those polyphenols in specific doses can be beneficial because our body creates a response, which then helps us to heal. However, if you're having something that's high polyphenol count, it's in a specific vegetable or whatever, but it's also high oxalate, we don't have that same response to the oxalates. There is no counteracting it. Our body has no defense mechanism for it specifically. We don't have anything that's going to change the way that it is or change its state, turn it into something else, and then use it for something. We just don't. However, luckily for us, we have Oxalobacter formigene, which sounds like a Star Wars character, but it's actually a bacteria that we have. And it's the only bacteria that we have. Actually, that's not true. We have other ones, but it's the most efficient bacteria that we have to help to degrade the oxalates within our intestinal tract. Problem with that, because of course you knew I was going to come up with a problem for the solution, is that if you're someone who has had chronic infections throughout your life or chronic exposure to antibiotics, or someone who has had certain specific medications, gastric bypass surgery, leaky gut, any of these things, you are going to have low levels of this bacteria, unfortunately. So we need to build it back up. I'll get to that in a bit. Now, if you're somebody who says, okay, I've never had an abuse of antibiotics throughout my lifetime, I didn't have chronic infections, I didn't have chronic antibiotic use, I've never had gastric bypass surgery, this doesn't apply to me, I'll be over here drinking my green smoothie with my blueberries and my almond milk. It does in that case apply to you. You see, these bacteria feed off of the oxalates. However, if we expose them to too much oxalate, they're going to die. We kill them off because it's too much. They can't handle it. So a little bit is good, too much is bad. You know that whole caveat of too much of a good thing could be a bad thing? That's kind of where they go with this. So while we want to feed them, we don't want to overfeed them because they will die. So I promised I would talk to you guys about having a high oxalate diet. You know, here's the thing. We have certain ranges and certain levels. So we need to calculate your oxalate load, which I'm not going to give those numbers out in a YouTube video because I want to see you. I want to talk to you. I want to make sure that you're being honest with yourself as to what your load is and properly tracking. And I know people don't really like to track their food. I hate food tracking. I don't do macros and all of that crap. I can't stand it. It drives me crazy. But for this purpose, we do need to assess how much oxalates are you exposed to in order to know what path you need to take to limit the exposure and to bring down the oxalates that you have in your system. Something else I like to tell my patients to be aware of that most people don't even seem to think about, which I find odd, is the supplements you're taking. And I've forever and a day been preaching the idea that be careful what fillers are in your supplements. That's why I'm so brand specific when I recommend supplements to my patients. And I'm not just one brand specific. Sometimes I like Designs for Health. Sometimes I like X, Y, and Z. Sometimes I like whatever. Based on the supplement I'm recommending, which I don't recommend a lot on carnivore because you really don't need much. I mean, brain, liver, kidney, heart supplements, sure, but that's food. That's not synthetic made in a lab. When you're looking at certain supplements, you have to be careful that they don't have defatted almonds and certain other ingredients that would be high oxalate. If you have ingredients or fillers in your supplements that are high oxalate, that's going to create obviously an issue, and you're not going to be calculating that. So sometimes people come to me and they go, well, I'm doing the right things. And then I look at their supplements and I go, ooh, you know what? You're actually increasing your oxalate load by this much here and that much there. And it really does add up at the end of the day. I had one patient who loved her almond bars. She had these really healthy, yummy, high-fat almond bars that she was making, and she put dates in them to sweeten them because, you know, that was the old school of thought, was that it's better than adding sugar as a date. A date is a natural sugar. So we use dates in, oh gosh, I use dates in my smoothies. I use dates in a bunch of things to naturally sweeten them. However, you guessed it, dates are high in oxalate. I personally didn't do a lot with almonds, and I'm really thankful because I found that almonds, I got a rash and they bothered me. To me, I knew that almonds are highly inflammatory, so they would heighten my inflammation. And I just didn't want to have an inflammatory response when I already had enough going on with various inflammation from my autoimmune conditions. So I'm happy that I avoided that whole almond trend that came about, but I didn't avoid the spinach trend, which, was not so great. Something else I want to mention for all my friends out there that are cannabis peeps. I know a lot of you guys like to vape, which is great. That's fine. If you're vaping the flower, fantastic. But I know others of you are out there and you're using cartridges, whether it be for vaping cannabis or for your terpene profiles or whatever, and you're using PEG, which is polyethylene glycol. PEG is actually a man-made substance that within the body does turn it into oxalate. So something else to be aware of if you are someone who is utilizing that and getting it into your body, it is going to turn that into oxalate. You are going to increase your oxalate load, and you do need to count that. And personally, I would be swapping you off of anything that has VG or PEG or any of the harmful, in my humble opinion, harmful ingredients in them. It's just some extra food for thought, folks. So what do you do if you have an abundance of oxalate within your system? We all know that the kidney and the liver are going to process it in a certain way. And hopefully, it's going to bind to some calcium and off it's going to go. No harm, no foul. Unfortunately, this isn't always the case. You've heard me talk many times about the burden of the liver. Our liver is easily burdened, and oxidative stress, not a great thing. Our livers can only handle so much. So while our liver is part of the process for getting rid of liver, kidney, get rid of, oxalate, dump it out, it doesn't know how to handle high levels of oxalate. So this is where the issue comes in. The liver gets overburdened. Okay, so we also want to mention, of course, the kidney aspect of it, because obviously, if your liver can only handle so much, go further down the pathway, it's going to get dumped in your kidneys can only handle so much. It's going to throw it out into other organs, other cells. I find, and I spoke about this in a previous video, I do find that within the bladder, urinary tract infections, that's due to oxalate crystals, that's an issue. And going further down, vulvodynia. So ladies, clearly this one's for you. If you find that you're suffering from vulvodynia and you can't figure out why, you might want to get rid of those oxalates and see if you get some relief. It's worth a try. And we can go back up, we can go up even higher. We can look at the aorta. There have been studies that have showed, calcium deposits in the aorta. There are, in our muscles and our joints, which makes sense because if you have a higher oxalate load, you can get achy bones and achy joints. And the thyroid, we found oxalate deposits within the thyroid. So I've had patients that have come to me and, you try to correct the gut issue, but then we've moved on to a low oxalate or a carnivore diet and found relief. I myself no longer have Hashimoto's, which I did contribute to the fact that I went carnivore. There are some low oxalate groups that are out there, and the consensus amongst those who have had thyroid issues is that yes, it actually is possible, and they have seen a reversal of symptoms when they've had a thyroid disease. So it does target quite a number of our organs. I've left a bunch of things out, but itchy eyes, I've mentioned that before. It's like shards of glass, and it's itchy and it's uncomfortable, and that can be an oxalate issue also. All right, so in closing, because it's getting dark out and I should probably shut this thing down, I just want to say that if you're someone who's injured, You may have tuned into some of my peptide therapy talks, but something I didn't mention is that oxalates like inflammation. So if you're suffering from inflammation, you've got a joint that has inflammation and pain due to an injury, those oxalates are gonna go for that. They're gonna gun it there because it's a weak spot. It's almost like they are attracted to our weak spots. So you're gonna wanna pay close attention to your diet post-injury. We all know that protein is fantastic for repair. So my best advice to you is if you're injured, go carnivore. Get your fat, get your protein, all good. You are not going to miss out on any nutrients. You're going to be just fine. You will not die. You will not get scurvy. And no, you do not need fiber. You will shit just fine. Hope you enjoyed my video. It's a little bit shorter than a lot of my other ones, but I wanted to quickly get to the point so that you had the first and second of my series on oxalates. More to come, folks. See you later.